Let's start with our first section of the lecture, disorders of the middle ear. And in this section, we will talk mainly about the acute suppurative otitis media. In this section, we will talk about what are the routes of infection of acute suppurative otitis media, what are the predisposing factors that lead to otitis media, especially the suppurative otitis media, and how we can treat it. So first, the acute suppurative otitis media, and what is acute suppurative otitis media? Suppurative is the term used for mainly pussy discharge or discharge that has pus in it. And acute is the term used for short term as compared to chronic, which is the long term duration. So acute is for the short term duration. So acute suppurative otitis. Otitis is the inflammation of the ear. Otto is for ear. Itis is inflammation. So, and media is specifically for the middle ear. So it's the acute suppurative otitis media. It's the acute inflammation of middle ear by pyogenic organisms. So pyogenic, as I mentioned, it's suppurative. So it has to be caused by the organism which can cause pyogenic or can lead to the formation of pus. So these are mainly the pyogenic organisms. It implies or it involves the middle ear cleft and middle ear cleft. If you see in this diagram, this portion is the middle ear. These are the ossicles or the small bones of the middle ear present in the middle ear. And this is the cleft, middle ear cleft. All this middle ear cleft including the eustachian tube. Eustachian tube opens into the middle ear. Then we have the middle ear itself, then the attic, editus, antrum, and mastoid ear cell. All these different structures are present in the middle ear cleft. So it involves the middle ear cleft and is caused by the organism, which are mainly the pyogenic organism. This is the eardrum, tympanic membrane, then the auditory bones, and then we have the eustachian tube. This is the picture that gives the fluid, and it's yellowish suppurative fluid or suppurative discharge. It's common in infants and children of lower socioeconomic group. Now, what are the different routes of infection, or what are the different routes through which the infection leads to the middle ear or reaches the middle ear? Mainly there are three routes. One is through the external ear. It's exposed to the environment, it's exposed to the injuries, traumas. So any injury, trauma, infection that involves the external auditory canal can reach the middle ear, especially sometimes due to damage to the tympanic membrane. Then we have the eustachian tube through the throat, nose, and then it reaches the middle ear with the through the eustachian tube. So that's another route of infection. And then there is blood-borne route of infection also, which is not very common in the as long as the middle ear is concerned. So routes of infection: eustachian tube. This is the eustachian tube through the lumen of the tube or along subepithelial peritubal lymphatics. So eustachian tube, through the lumen or hole of the eustachian tube or along subepithelial peritubal lymphatics. Or lymphatic system or lymph nodes present around the peritubal means around the tube. So it also spread through the lumen or through the lymphatics. Then external ear trauma or traumatic perforation of the tympanic membrane also cause middle ear infection. Then another blood-borne is not a very common, it's uncommon route, can occur in cases of septicemia when the microorganisms reach the bloodstream and when it goes to the middle ear, or it can cause infection, but it's not a very common route of infection. So mainly tympanic membrane, and then it's through external auditory meatus or canal, and then uncommon is the blood-borne. So three common routes, or three routes of infection, out of which two are common, which are the eustachian tube and the external auditory meatus. Then we have some, what are the different predisposing factors that can lead to suppurative otitis media. Factors include, one is if somebody has recurrent attacks, they keep on having attacks of upper respiratory tract infection, this can lead to suppurative otitis media, or conditions or diseases like measles, diphtheria, or whooping cough. If the patient has these, which are the common diseases of the children, they can cause the acute suppurative otitis media. Then the other is infection of tonsils and adenoids. Tonsillitis and adenitis can lead to suppurative otitis media. Then chronic rhinitis and sinusitis. If somebody has sinusitis and chronic allergies or rhinitis, they can have suppurative otitis media. Nasal allergies, tumors of nasopharynx, packing of nose or nasopharynx for epistaxis. Epistaxis is the bleeding nose. So if there is packing of the nose to control the bleeding, that can lead to suppurative otitis media. And then the cleft palate can also lead to suppurative otitis media. So all these are very, very common predisposing factor, very common. Somebody with upper respiratory tract infections, rhinitis, sinusitis, allergies, they always complain of pain in the ear, and sometimes because of increased pressure or inflammation or fluid in the middle ear, it causes pressure on the tympanic membrane and leads to the perforation in the tympanic membrane. So all these can lead to acute suppurative otitis media. This is the bacteria which commonly cause suppurative otitis media. We have Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. The treatment is of the acute otitis media. All these are the different antibiotics which are tried for in 3, 4, 5, 2, 1 divided doses. And the common antibiotics are amoxicillin, ampicillin, co-amoxiclav, erythromycin, cefaclor. All these are the cephalosporins, first generation, second generation, third generation. So cefixime, then we have cefpodoxin, ceftibuten, cotrimoxazole, or Septron. So all these are commonly used antibiotics, depending some in 3 divided doses, 4 divided doses, 1 and 2. So all these are the common antibiotics used for the treatment of acute suppurative otitis media. So acute suppurative otitis media is acute inflammation of the middle ear caused by pyogenic organisms like Streptococcus pneumoniae, different antibiotics are used for, and 3 routes of infection: eustachian tube, external auditory canal or ear, and then uncommon is bloodborne as a result of the septicemia. And then it's a very painful condition, and then sometimes as a result there is perforation of the tympanic membrane and there is pussy discharge from the middle ear. And then we have, this is the how we can actually treat, what are the two, mainly the paths how we can treat the acute otitis media. Here if you see somebody with acute otitis media, the first thing to try is, as we mentioned in the previous slide, some antibiotics are tried. So antibiotic therapy, and usually patient is reviewed after 48 to 72 hours. If there is earache and fever persist or increase, if there is no improvement in the condition of the patient, then usually another antibiotic is tried, and then for 10 days, or there is myringotomy or opening of the tympanic membrane. What happens with this incision or myringotomy, that the fluid or pus discharge is drained, and usually this helps to relieve the pain and the fever. So another antibiotic, and then sometimes this leads to complete resolution of the condition. If doesn't resolve, then we can have persistent fluid, and if there is still persistent fluid but earache and fever abate, then you can try periodic check for 12 weeks and then complete resolution. So until the complete resolution occurs, if the effusion or fluid persists, then we can treat the otitis media as otitis media with effusion. So first, antimicrobial therapy, assess after 48 to 72 hours, condition is not improving, try another antibiotic, do myringotomy. If the condition improves, that's fine. If again pain is resolved but patient will have fluid, usually we can treat this condition as otitis media with effusion. And in another case, if antibiotics are started and patient is assessed for after 48 to 72 hours and there is good response, we continue that antibiotic until there is complete resolution. So these are the two pathways which can be tried in patient with acute suppurative otitis media. So decongestant nasal drops, which include ephedrine nose drops, oxymetazoline or xylometazoline. Then we can try some oral nasal decongestants, which are pseudoephedrine and combination of decongestant and antihistamines. And if there is fever, analgesics and antipyretics like paracetamol. So all these are tried decongestants. We can use nasal decongestants. We can try oral decongestants along with antihistamines. And we can ear toilet to clean the ear of any pus, any drainage, or dry local heat can also be tried. Myringotomy, myringo is the term used for tympanic membrane, eardrum myringo. Otomy is the open incision or cut. So incision in the tympanic membrane or eardrum to drain the pus or discharge. So that was all about the acute suppurative otitis media. Thank you for watching sqadia.com.